the improvement has been across the board in all counties. I'm sure every single county has a story to tell. And the numbers, as I said, speak for themselves. You can look at how many doctors there were vis-a-vis how many there are now, nurses, even community health workers, but also in the actual measurable output, right, in terms of reduction in maternal mortality rates, in terms of skilled deliveries, in terms of vaccination rates. I'll give you some figures for this county, for instance. And this data is available for all counties because it's collected and collected centrally. In terms of additional facilities, before devolution we had 88 facilities of different levels. As I speak today, we have 174 registered healthcare facilities. Actually, we're probably in the top 5 or 6 in terms of number of registered as Wajir County. Our maternity units have increased from 37. Of those 88, only 37 had maternity units to 117. Right? We established with county funds a medical training college, which we handed over to Kenya Medical Training College and an agreement on how many students they need to admit from Wajir County, from the wider northeastern region, and from the rest of the country. And what that has done, we're now assured of a pipeline of nurses and that cadre of technical staff. Immunization has increased in terms of coverage from about 50% to 80% by March 2026 figures. The first antenatal care visits have improved from 45 to 80% because of the nature of our terrain and the mainstay of our people being nomadic pastoralists. At times, there are people out there who would never visit a clinic, mamas, for the entire period of expectancy of delivery. So ANC, which is antenatal care, has improved from 45%, the first access, to 80%. Skilled delivery, still a challenge, but it's grown from about 36% to 60%. So because, again, of the environmental setting, there's still a lot of home deliveries. But an improvement from 36% to 60% in 30 years is no mean feat. Prevention of mother-to-child transmission of HIV amongst the antenatal clinic mothers, visiting mothers, has also increased from 20% to 90%. So, taken across all sectors of health, we can actually say there's been significant improvement. Other than the 174 physical facilities that we have, we also run an outreach program, because you might find one physical facility somewhere, a hospital unit, but there are many villages surrounding it. And what we do through the CHPs and even field visits, we also carry out outreach programs. And this has really helped. If you look at the data with respect to human resource, we had 0 consultants. Then now we have over 22 of them. We also have about 16 or so that are 17 there around at any one time that are in school. So as a group leaves after, because we usually bond them for a few years after they graduate. After some leave, having finished their bonding period, we always have a pipeline of others joining. Medical officers, MOs, these are ordinary doctors, first level. We had only 2. Actually, when I just joined, there's only 1, and then another was reporting at the time. So before devolution, I can actually say there's only 1 who was. Now we're talking of 55 MOs. 55 MOs. Pharmacists, we had 3. We now have 7. We could do much better there. Nurses, there were 80, now 450. Registered clinicians, they call RCOs, there were 20, now we have 70. So you can see these figures speak for themselves, you know. Notwithstanding all those successes, there are still challenges, as I said, especially with respect to health financing and the issues of SHA, which could be managed much better. That's all I want to say about that. But we've set up facility improvement funds across all our facilities. We still have challenges to do with high staff turnover because our area is still deemed hardship area. And especially for the consultants, whenever they finish their bonding period, they find opportunities outside of the county. So retaining them has been a bit hard. And that's why we're adding a private consultation wing to the level 5 so as to allow them to practice around here. And we even encourage setting up of proper private hospitals because we believe that can also help them stick around. There are places that sometimes we face insecurity, especially very close to the border with Somalia, which limits movement of outreach services to the very peripheral villages. We also have cultural barriers on the demand side, on the health-seeking habits. And we see this especially in the area of mortalities during childbirth. Because the sign-off of the husband in a lot of times is what actually allows the cesarean operation to be carried out. People still believe that it's cesarean births are not right, and they probably give us the go ahead or the sign off when it's too late and in the process. And so there's still a lot of sensitization and education that's required in that particular aspect, because there are delays in decision making with respect to carrying out life-saving operations in many cases. So that's what I want to say. But overall, I want to repeat. And the figures that I have, which I gave you, are specific to Wajir. But as chair of council, I can tell you, because we discussed this at many a forum. Doctors in public district hospitals increasing from about 800 to over 5,000 now. Nurses from about 6,000 to over 40,000 plus. The CHP program, which we are co-partnering with the national government. The improvement of facilities. The national equipment, services program. The NESP, which is helping us equip public health facilities across board. I always thought of there's constantly going to be something that's done to continue improving public health care. But not only in health, but in all areas that are devolved, I can say, without the fear of contradiction, that we're better off today than we were 13 years ago. No comparison whatsoever. Can you imagine in 2013, Wajir town, right? Wajir town of 2013, hosting the National Madaraka Day. All right? Where there was no single, not even a meter of tarmac. Right?
Yeah.
The only meter of tarmac that we had, the only tarmac we had anywhere was in the runway of the international airport. Right? Yeah. So I think we've come a long way. And as a country, we are hard on ourselves. As a people, we are hard on ourselves. And we find it easier to find fault than to appreciate. And it's good to find fault in government services for the sake of improving those. But it's also good to appreciate when there's an improvement. So there's been a lot of improvement, tremendous improvement across board. And in the welfare of people, in education, in healthcare, in provision of all other services, and devolution has been quite catalytic in bringing about that improvement.